आज आपल्याला रेस्पिरेशन टॉपिकच्या शेवटच्या काही 1, 2, 3 युनिट्सकडे जायचं आहे. काल आपण रेग्युलेशन ऑफ ब्रीदिंग पूर्ण केलेलं आहे आणि त्याला जोडून लंग व्हॉल्यूम्स पण आपण पूर्ण केले. आता लंग व्हॉल्यूम्सचे जे काही डेफिनेशन्स आणि त्याच्या फिगर्स आहेत त्या तुम्ही तोंडपाठच करणार आहात आणि त्यावरती असणारे MCQ मी तुम्हाला पाठवत आहे, ते तुम्ही सॉल्व करा आणि नंतर आपण ते डिस्कस करू. बरोबर. आता आपण पुढे जाऊया आणि ते म्हणजे मॉडिफाईड रेस्पिरेटरी मुव्हमेंट्स. एक छोटंसं 2 ओळींचं युनिट आहे आपलं. तर मॉडिफाईड रेस्पिरेटरी मुव्हमेंट्स म्हणजे काय? सो some respiratory movements are different than the normal. Different than the normal means what? Now you are familiar. In normal respiratory movements, there is a breathing occur, that is expiration and inspiration. Then it is followed by mechanism of respiration, that means transport of oxygen and CO2 at lung level and at tissue level. That is called as normal respiration. But some respiratory movements are special, and these special respiratory movements help to express emotions. They help to express emotions. Like, you know very well, crying, laughing, then yawning, etc. Right? So these emotions, they are specially for or to clear the air passage. So these modified respiratory movements which help to express certain emotions to clear air's passage. That's why they are called as some special respiratory or modified respiratory movements. Now, they include reflexes. For example, coughing, yawning, coughing म्हणजे खोकणे, yawning म्हणजे जांभई देणे. So, these are some of the reflexes which are included under this modified respiratory movement. So remember in one sentence only, these respiratory movements are special one and they are helpful to clear air's passage in respiratory system, and there are certain reflexes, for example coughing, yawning, or maybe certain emotions. Okay, so here we complete this modified respiratory movements. Now we'll go to the next but important subunit known as common disorders of respiratory system. Now these common disorders of respiratory system, they are given in tabular form in our textbook, and this table include columns such as the name of the disorder, then symptoms, then causes and treatment. So there are total 8 disorders are given: emphysema, chronic bronchitis, acute bronchitis, sinusitis, laryngitis, pneumonia, asthma, and occupational disorders such as silicosis and asbestosis. Now we will learn one by one. At first, emphysema. Now you can open your book in front of you and study these disorders. So the next column tells us about symptoms. म्हणजे लक्षण. So symptoms of this emphysema are breakdown of alveoli and shortness of breath. Breakdown of alveoli and shortness of breath. So inside the lungs, the alveoli are very thin, small and delicate. So they broken down, and due to which the exchange of gases becomes difficult and creating shortness of breath. That is called as emphysema. Now what is the cause? Cause is shortness of breath. The cause is specifically given smoking and air pollution. Smoking and air pollution. Some people are habituated for smoking, tobacco smoking. They are suffering from this kind of disease or disorder, and today are well known. The air pollution is increased tremendously. So due to air pollutants, entry of this air pollutants in the gaseous form, in the particulate form, there is a shortness of breath occur, breakdown of alveoli occur, causing emphysema. So the treatment is quit smoking. So do not smoke. Quit smoking and avoid pollution. Also avoid pollution. Smoking should be quit. Air pollution should be quit, so that you are free from such tobacco particles which are entering in our lungs, as well as pollutants which are entering in our lung, and you will get clear from this disorder emphysema. So that is about emphysema. Then chronic bronchitis. Again the symptoms are coughing and shortness of breath. Shortness of breath. Again the cause is similar, smoking and air pollution. And ultimately the treatment will be same. That means or you can say do. Smoking and air pollution should be quit to avoid this chronic bronchitis. In chronic bronchitis especially, the bronchus is affected. Both right and left bronchus may be infected or undergoes swelling. So that's why the word titis is used. Tis means swelling. So there is a chronic swelling occurs, coughing occurs, there is a shortness of breath, and that is due to smoking and air pollution. So quit smoking, quit air pollution. So you will get free from chronic bronchitis. Then acute bronchitis. In acute bronchitis what happens? There is an inflammation of bronchi. Inflammation or swelling of bronchi occurs. Here the cause is due to bacteria and viruses. Bacteria and viruses. Infection of bacteria and viruses. So take antibiotic under treatment. Take antibiotic and cough medicines. So take antibiotic and cough medicines to treat acute bronchitis. Clear? So the difference between chronic bronchitis and acute bronchitis is that the chronic bronchitis is due to smoking and air pollution, but acute bronchitis is due to bacteria and viruses. Remember, that is the difference. And the treatment is also different. In acute bronchitis, we have to take antibiotic tablets or medicines, and also cough medicine. Right? Then sinusitis. Now sinusitis, tis means inflammation. That means sinuses which are present in our face region or in our skull region. These sinuses, they are inflammation, swell. So inflammation of sinuses occur. Inflammation of sinuses occur, and the cause is same, again due to bacteria and viruses, and treatment is again same, take antibiotic and medicines. Right? Then laryngitis. Laryngitis means larynx means sound box, tis means swelling. Right? So inflammation occurs to larynx. Inflammation of larynx. Inflammation of larynx occur, and also sore throat is there. Sore throat is there. म्हणजे लालसर घसा. Then hoarseness of voice. Hoarseness of voice. Hoarseness of voice म्हणजे घोगरेपणा. Then mucus built up and cough. Mucus built up and cough. So in laryngitis, sore throat, hoarseness of voice, mucus built up, and cough formation occur. So these are the symptoms seen under laryngitis, and the cause is same, due to infection of bacteria and viruses. Right? So ultimately take antibiotics, cough medicines, etc., and voice rest, and avoid irritants. In addition, as it is infection to the larynx, take rest, do not talk, take rest, voice rest, that is called as, and avoid irritants like smoke. Do not go in smoky area to avoid laryngitis. Then pneumonia. Now pneumonia is inflammation of lung. Pneumonia is inflammation of lungs. Inflammation of lungs ranging from mild to severe. There is a cough formation, shortness of breath, chills, sweating, chest pain, blood in mucus. So that is related with lungs. Many other symptoms are seen in addition to the swelling of lungs. Right? The cause is same, due to infection of bacteria and viruses. Now here, prior to taking antibiotics, you should consult your physician immediately. So consult physician immediately. Consult physician, that means doctor, immediately. Because the infection reaches up to lungs and there is a damage to lung may occur, and to avoid the death due to damage to alveolar and lung due to pneumonia, you must immediately contact your doctor and consult your doctor or physician. Then asthma. Now asthma, it is a constriction of bronchioles. The symptom shows constriction of bronchioles. That means narrowness of bronchioles occur, and due to which the air passage towards lung may block. And due to this, there is a difficulty in breathing. Due to constriction or narrowness of bronchioles, the breathing becomes difficult, and that is called as asthma. And the causes are allergy, pollen grains, certain food, etc. So due to allergies, pollen grains, some food additives, pet hairs, you know very well pet hairs, that means hairs of cat, dog, which we have domesticating in our house. So hair falls in our house and they may get entered in our respiratory tract, due to which this asthma occur. Now treatment is use inhalants to open the passage. Use inhalants. Use inhalants. That means you know very well the pump. In specifically asthmatic patient, one pump is there. In that pump, one tablet is poured. The tablet contains powder containing medicine, and when you inhale that powder, the diameter of these bronchioles especially enlarge. The constriction is converted into relaxation, and the diameter of this bronchiole relax or increase, and the air go easily, and the difficulty in breathing now gets over. So use inhalants in case of asthma. Then occupational disease like silicosis and asbestosis. Now in this, there is an inflammation of fibrosis and lung damage. Inflammation, fibrosis, inflammation, fibrosis, inflammation, fibrosis and lung damage may occur. Lung damage may occur. Why and how? Now occupation means your work. The work or workers who are working in the industries where silicon and asbestos is produced. So industries where silicon and asbestos is produced, in that the persons are working. So that worker, that is their occupation, right? So during working, during the production of these two components or two substances, you can say silicon and asbestos, constant very fine particles of the silicon and asbestos may inhaled or enters in the respiratory tract of these workers, and due to which the fibrosis occur inside the lung alveoli, and due to fibrosis there is a damage of lung occur, right? So to avoid here, so that cause is long-term exposure to the silicon and asbestos. Long-term exposure to silicon and asbestos. So treatment is use protective mask. Use protective mask. Use protective mask while working in the industry where silicon and asbestos production occur. Okay? So in that way, here we complete these common disorders of respiratory system, under which we have studied all these 8 kinds of disorders, having each one which are the symptoms, which are the causes, and how the treatment is for that particular disease, right? So learn these, remember these, and memorize these. Okay. Now we'll go to the last unit, and that last unit is artificial ventilation. Now what is meant by artificial ventilation? Artificial ventilation. Now this is artificial respiration. Artificial respiration. Now natural respiration include breathing containing inspiration and expiration. And we have studied in detail how this inspiration and expiration occurs with the help of components of thoracic cage, that is sternum, intercostal muscles, ribs, and diaphragm, and thoracic cavity. Here, this artificial respiration or this method of breathing, artificial breathing, is induced when natural respiration is stopped. So it is used when natural respiration is stopped, or in another word, natural breathing is stopped. And it is used quickly and properly to avoid death due to drawing. Another cause, choking, drawing, choking, or suffocation, electric shocks. The patients, the human beings or patients, which are not respire naturally due to drawing, choking, and suffocation, or maybe due to electric shock, in that cases, this artificial respiration is utilized. Clear? Drawing म्हणजे थोडक्यात बुडणे, पाण्यामध्ये बुडणे. चोकिंग, काही वेळेला रेस्पिरेटरी सिस्टीम मध्ये एखादा पदार्थ अडकतो. उदाहरणार्थ लहान मुलं खेळता खेळता काहीतरी नाकामध्ये घालतात, त्यामुळे रेस्पिरेटरी पॅसेज ब्लॉक होतो, तर त्याला चॉकिंग म्हणायचं. सफोकेशन, काही वेळेला आपण अशा ठिकाणी जातो की जिथं कार्बन मोनॉक्साईडचं प्रमाण वाढलेलं असतं, उदाहरणार्थ गॅरेजेस, आणि तिथं आपल्याला श्वास घ्यायला दम घुटतो किंवा त्याला सफोकेशन म्हणतो आपण. आणि इलेक्ट्रिक शॉकमध्ये काही वेळेला लंग्सचं फंक्शनिंग जे आहे ते थांबू शकतं. अशा वेळेला आपण हे आर्टिफिशियल रेस्पिरेशन वापरू शकतो. क्लियर? नाउ व्हाट इज दिस आर्टिफिशियल ventilation or process? The process of artificial ventilation occurs by two ways, especially in which, or it occurs by two steps in which established and maintain of open air passage from upper respiratory tract to lungs. So from upper respiratory tract to lungs, the passage is clear. Passage is clear or maintained, and forceful. Another step is forceful inspiration and expiration through mouth is taken by means of through mouth by ventilators. Machine. It's a kind of machine. So artificial ventilation can be brought about by two steps or two processes. One is clearing upper respiratory tract to lung passage, and another is forceful inspiration or expiration through mouth by ventilator machine. Clear? Now what is ventilators then? What is ventilators? Now ventilator is a machine. It is a machine. Now you are familiar with this word nowadays. So this machine supports breathing. It supports breathing. Supports breathing. It supports breathing, especially during surgery. You know very well. During surgery, during accidental cases, during just we have studied the disorders related to respiratory system, during which when normal breathing is impossible or fails, the ventilators are used for, so they are used for life supportive system when normal breathing is not possible. Now the best example, today's example is COVID-19. COVID-19. We are undergoing the lockdown due to this COVID-19 virus spread all over the world. Many of peoples, in number of countries, many of people, they need the ventilators to overcome this COVID-19 infection. So I will not explain a lot about this COVID-19 because you are listening all these in news on TV channels. So ventilators used for life supportive system in various infections where normal breathing is not possible, and hence the work of this ventilator is to get oxygen into lungs. To get oxygen in lungs. Right? Second work is remove CO2 from lungs. Or remove CO2 from lungs. And third work is help the patient to breathe. Help patient breathe. Right? So these are the three works of these ventilators: to get oxygen inside the lungs automatically, remove carbon dioxide from the lungs automatically, help patient breathe because breathing, normal breathing, natural breathing is failed in these cases like infections or during surgery also, again in accidental cases also, and that's why such artificial ventilation containing this machine, ventilators, they are used to overcome this problem, to overcome the death. Okay, so here we complete all subunits under our respiration topic, and the total units are 8.6. From 8.7, the circulation, another half part of our topic initiates. So here from 8.1 to 8.6. We have complete all the points under respiration. Now we'll go to the MCQs. Okay. Now learn all these points. In today's video, we covered certain modified respiratory systems or functions, then common disorders, total 8, and at the end artificial ventilation. So go thoroughly, learn these points again and again to memorize, to remember, and then solve MCQ.